I'm Dr. Wachtel. This is my running website. And what do I see the most of in my practice? Bizarrely, nail fungus. Nail fungus is so common and very interestingly can be treated with something so simple. So, what is a fungal infection? It's fungus, just like you would see mushrooms on the ground. This is fungus that's growing on our skin naturally. Unfortunately, with trauma, which is the number one reason for nail fungus, it will get underneath the skin fold and into the nail bed, the fleshy part underneath your skin. And that's exactly why you get fungal nails, because the fungus gets under the nail, on the nail bed where the nail is growing. And then the nail becomes thick and white and discolored and can cause infections. And we've been talking about not only runners, but diabetics in the site. And diabetics with fungal nails, that's an issue because the thicker the nail, the more they ingrow, the more they get infections. So clearing nail fungus is very important. So today there's the most easy and common way of treating nail fungus is topical meds. There are oral meds like Lamisil, but the problem with Lamisil is toxicity. It taxes your liver. I try never to prescribe it. I find that if you do take Lamisil, there are a portion of people that once the medicine is out of your system, an oral, very strong antifungal, once it's out of your system, then I'm finding more and more nail infections recurring with fungus. So the easiest way for me to convince my runners and my diabetics, both of you, you know who you are, is to use a topical. We carry a topical in the office, and now it's going to be on my website, so you can all get a bottle. You rub this medicine on your nails, all of your nails. How do you know which nail is infected with fungus? Typically, they're not clear. Typically, they're white, brown, or yellow, and crumbly. And unfortunately, it goes from one nail to the next nail. So once you start this topical regimen, it's twice a day. I'll say it again because repetition is key in medicine. It's twice a day. Number 2, morning and night. And then you put it on all the nails from the cuticle forward underneath the nail as best you can. And I would recommend you start with this as your first step towards getting good nail health. Clear, non-brittle nails, and that's it. We have this topical on site, and I would recommend you consider getting some and trying it for. Don't start it and then expect a miracle within a week. I would say do it for a minimum of 3 to 6 months, and you should see a progression and a change. If you're finding after 3 months of treatment you have no change in thickness or color, that's when I would recommend you visit a local podiatrist and maybe have that discussion about doing an oral antifungal. But topical should be first. Thank you.